Business Spotlight, brought to you by Cross Rhythms and Baba Baboon.
I'm Sonya and welcome to Business Spotlight in partnership with Cross Rhythms City Radio and Baba Baboon. Joining me in the studio this week, we've got Dr. Ruth Chambers OBE, who's one of the founders of Raparu Consult CIC. Hello Ruth, how are you?
Great, thank you very much, Sonya.
Good. Thank you for coming into the studio. It's an absolute pleasure to have you in here and to find out a little bit more about the CIC. Now, which is obviously Raparu Consult. But Ruth, your background, you're a doctor, obviously, former GP, and you're a digital lead for the NHS. So how did that transpire? And how did you have you put that effort, all those skills and all that experience that you've got into Raparu Consult CIC?
Yeah, and it's obviously not just me. It needs also people who are good on managing and people who are good on the community side of it. But I've wanted to collect all that I've thought and helped and worked for over the years, and not just retire and watch daytime TV and listen to Cross Rhythm, of course.
And listen to, yeah, of course.
But also to put what I've learnt about to help other people. And that's been the same with the others that I've worked with. So we've tried to put together our thinking and then delivery on how we can help people, inspire them to stay more healthy themselves, those people out there and everywhere, whatever their age or ethnicity or their background, and get them thinking how they can use technology, even if they're not really used to it in their everyday lives, maybe to help them a little bit more, and to put that together at scale if we can.
And one of the co-founders is Paul Eden, who's the managing director as well of Home Instead, who are also based in Newcastle under Lyme, like yourselves, like Raparu Consult CIC. But just talking about, can you just elaborate a little bit more on what are the aims and aspirations of Raparu? What do you do in the community and how do you do it?
Well, as I said, we want to inspire people and promote them for healthy working. Now, that could be then to stay in their job. And so we've been lucky enough to get funding from the Shared Prosperity Fund to put together healthy workplace kits. And we've taken them around to so many businesses locally over the last 3 months or so. And the individuals are so grateful. I mean, the other day I took one bag to the custody site of one of our local courts for the staff. And I went to talk to somebody else. When I came back, 6 people had taken their own blood pressure and found that for 2 of them that it was raised. Wow. And they couldn't wait to look at the other bits. Now, as well as that, we've gone direct to the community, and sometimes that's been with the help of other GP practices. And for instance, we did a fantastic event in Longton Library where the practices around invited people, the right sort of people who might be interested in menopause, and a week before. And we were also launching a book we've done on the menopause and how people can combat the effects of it. And you wouldn't believe it, but 70 people turned up. And while they were there, we also checked their heart rhythm, because that can be connected sometimes as people get older and have got menopausal symptoms.
So the work kits then that you take out to organisations, like you say, it looks like they're varied, whether it's local businesses, communities, local courts. Again, everybody has got stuff.
Yes.
But what if somebody was to pick up one of these work kits, or you deliver them?
Yes.
You've mentioned blood pressure.
Yes.
What else is included? What are the benefits of having one of those kits, making use of one of those kits for their staff members?
Well, sometimes we do a talk and we might be talking about how they can use digital apps. And that might vary from mental health to getting the weight down, or back pain, or cognitive behavioural therapy, menopause. And so we put examples of those in the kits, and at the same time we're giving them advice on perhaps losing weight. And a lot of people can't calculate their body mass index. They just know what their weight is, but not related to their height. And so we give them digital analytical scales, which they love. We also do things like desk fans, and the ladies that see them say, "Oh, thank you," and they want it on the desk, or other people need to think about the light. So we have a desk light as well. So we do a whole range, trying to help people of all sort of ages and stages, and nearly everyone says, where can I buy this? I want one for my mum, I want one for my cousin, I want one for my brother.
Mm-hmm. So it is really then about, in a way, from how you're describing it, whether it's the menopause or even people, looking at thinking about their own blood pressure, it's again sort of opening the doors in a different way, how I'm seeing it, and raising that awareness and looking at things differently, but looking at maybe each individual differently as well.
Allowing them to do so. So I'm doing a project at the moment with a local mental health trust, and they were hoping that they'll use an app called Patient Aid. But the patient needs to have an email address. So they also need some help with some of the older people who've not got an email address, who could see the benefit of it if they did. And we'll be able to help with that. In another project we did with helping people with diabetes, we did focus groups. What do people need? Oh, well, actually, they wanted to be reminded to look under their feet every month to check if there was something like a callus or infection. And that could stop people having their feet amputated in the years to come. So we got a lot of Alexa Echo shows and put some messages on it to remind them every month to have a look under their feet, and they absolutely love that. I've written it up as a research project, and we get quoted on what we've done for those sort of things from across the world. Every week I hear, Ghana or the Philippines or America is read your work and is putting it in their research.
Oh, fascinating. So again, what you're doing there is bringing in, because, Raparu is about, upskilling as well with digital skills and all that sort of thing. So what you're doing there, again, you're opening up even more doors, but when you're saying people are connecting or contacting you or looking at your research, what you're doing here in Stoke-on-Trent and Newcastle-under-Lyme is actually reaching different, the corners of the globe, so to speak. How could that actually, if it develops, how could that again have such a massive impact on people's health and well-being?
Well, every day I get stories about how it's helped people and how it's inspired them. Or how they've helped somebody else. And we're full of stories. The problem is with Raparu CIC, we're really driven by helping people rather than being driven by business. And so we've got to keep remembering, if we're wanting now to develop, because we've only been going for 18 months, and if we're wanting to develop and expand, we've got to have a little bit more business side to us, which we try and do. So we're learning as we go along.
Every day's a learning day. We all learn, Ruth. We all learn. But the technology side of it then, how does Raparu use the technology, and why did you decide to sort of take it down that route as well, to use technology as part of all of this?
I think it just was from our experience of realising how much different people need help to use technology, and they need it in ways they couldn't have understood. I mean, in the COVID times, I really did try and do a project with electronic stethoscopes, and it didn't actually take off because it was so difficult. But you were hoping that someone could be in a nursing home with an electronic stethoscope, and then the GP in the practice could hear the actual rhythm of the heart and so on. And we got a few good case studies, but sometimes it's difficult to get things that are really at the innovative stage. And Raparu's tending to be more on the side where things are already established, and why don't more people use them? Like the digital scales and like email addresses and like using Alexa Echo shows. Yeah.
And so is it then with Raparu, is it an app of your own? Or is it an app? Do you sort of signpost people to use different apps to access information and things?
We always signpost people, but we're always checking that they are either free to access or free to start with, and there's a warning that maybe when they may be offered a premium. But otherwise, we go with charities like the British Menopause Society or the NHS, and we check them all first. And when we give out different cards, say every 3 or 6 months, we check they're all still in date. And that's appreciated because people can then trust them.
Yeah. And, you've touched on the menopause, you mentioned quite a lot, and it is more and more spoken about now than it was maybe years ago. And again, with the use of technology and everything, you say, you've written a book following on from this work that you've done with Raparu, solely focused on the menopause as well. How do you see that in your career? as well, and what you've done, how do you see now them changes? And again, opening up those doors and those barriers to say, we need to look at this in this way, we need to identify this person needs to look at this in that way. How have you seen that change, and how do you see it now in going forward?
Well, the menopause as a topic is a good example to give you, in that we've worked very closely with Professor Fidelma O'Mahony, who is the big chief on gynecology and menopause at Royal Stoke Hospital, with Professor June Keeling, who's a professor of women's health at Keele Uni, Dr. Bala, who's a very, very expert GP on women's health in Mere, as well as myself and the Raparu team and a medical student. Now, all those people's perspectives have meant we thought about the menopause from a very wide perspective, and we've taken it to local menopause cafes, like at the combined healthcare mental health trusts, and we've taken it to other menopause groups. Like last week, I went to the Back O'Connor group where in Stoke-on-Trent in Hanley, and talked to them about the menopause. So we've gone from like NHS staff to the general public and to people who need help, and as well as that, then we've taught GPs. And so we've done quite a lot of teaching sessions. This is all over really the last 6 months or so. And the Royal College of GPs in Birmingham asked us to go down and run a half-day event. And the local, what they call Staffordshire Training Hub for General Practices, bought 250 copies of the book to give out to GPs about 3 months ago when they covered the topic. And I've heard from one of those colleagues that the prescribing of hormone replacement therapy has shot up across Stoke-on-Trent since we've been taking this interest and going out and upskilling doctors and nurses as well as the public as to what they would expect.
So leading on from that then, the other side of it, health and everybody's sort of well-being and well-being in the workplace, are you looking to do that in other areas of health, whether it's, again, blood pressure or, diabetes or anything like that? Is there other organisations or, groups that you're looking to be working with in the future?
Well, we found quite a lot of interest from pharmaceutical companies, but in something that's called grants and donations, so that they're neutral. They don't have any say in how we deliver the project with different NHS organisations. And so we had a particular interest in finding people who've got what's called atrial fibrillation, the irregular heart rate, without realising it. Now, I've had an interest in this for a few years, and if I'm going to make you smile, Sonya, about 4 years ago, we produced a new app on how you tested yourself for NHS, with the NHS app, but with also with our own one to show how you check with your pulse on your wrist. And I emailed Mr. Tim Martin, now Sir Tim Martin, from Wetherspoons. Wow. And I asked him if we could put them on drink mats in the pubs across Staffordshire, and he agreed. And actually, our installation of that app went sky high with putting it across Staffordshire. Fantastic. Which just shows you the interest in it. Yep. Now, we've also been doing that a lot recently across Mere, and we've also been now about to look at chronic kidney disease and how we all need to be much more aware of that. And again, through quite a lot of upskilling of general practices, but also the public, because quite often people who've got diabetes may have kidney disease. And if you don't spot it, then they can end up having dialysis or even a transplant a few years later. So again, you're raising that awareness, but across so many different spectrums, avenues, and like you mentioned at the beginning, all different age groups. It's not just one particular age group, is it? No. We like a challenge, and we also like coming on with people. So, for instance, the South Stoke, what they call primary care network of practices, they're around the Longton area, and we've been sometimes to their public events, and they're having one on respiratory conditions. I think it's April the 23rd at St Paul's Church, and they expect to get 100 people to come there from texting them. And I know that means it's people who get texts, but also sometimes their families. And then we're going to have a stand there and help people realise they must look after themselves and their lifestyle habits. And we'll be like taking people's blood pressure, but also checking their pulse and also getting them to weigh and calculate their body mass index.
It seems like, I mean, sometimes, and just from experience maybe I've had with like family members or friends, where to go and do these things normally, I'll be honest, sometimes it can get quite stressful. Sometimes people can't go to like the GP, or they feel a bit, they're not sure if they should, or they feel a bit scared. This just again seems like another more relaxed way of looking into things, and again being educated, but also thinking about your health in a different way.
Absolutely. And that's been the essence of our work with the Shared Prosperity Fund that we've done for Stoke City Council, that we're wanting people to realise how they need to look after themselves so they can stay and work. Because we lose so many people, especially in their 50s, who drop out of work. But we've also focused on the young people in that project. And recently we've run a little seminar for medical students from Keele University.
Yeah.
And we've got them to realise how they need to be looking after themselves with their hopefully 30, 40, 50-year career to come. And they were very interested. And I actually did my PhD many years ago on work stress. And so actually I do bring that up quite a lot when it's thinking about healthy working for the younger age group, how they've got to realise that they anticipate work stress and avoid it or minimise it if they can.
And on the flip side of that, if somebody, you know, is a manager, a business owner, and they've got X number of staff, again, surely the productivity was, you know, if their staff members are more aware of how to look after themselves in different ways and are more educated, surely that's a bonus, it's a plus. And
that's our future hope and plan for the Raparu Consult CIC, that we want to work with a lot more businesses, a lot more organisations, now that we've done this preliminary work, but it's not really preliminary, it's based on so much of our other experience, so that we can help individuals in their teams, but do it in a more generic way. And we then run webinars as well as face-to-face events. So for the moment, there are 5 businesses that have signed up to look at the webinar that we've done, keeping it down to less than 30 minutes, trying to help people to see how to look after themselves, particularly focusing on avoiding work stress, combating back pain, and healthy lifestyle habits, so good mental health. And we've had a lot of interest in that.
Brilliant. So if there is somebody out there listening, whether they want to come along to a session, it's a member of the public, like the one you've mentioned, which is taking place at St Paul's Church in Longton on the 23rd of April. If there's anybody out there, you know, who's thinking I'd like more information, or even a business who's potentially interested in a conversation, to either, or a business owner even, or, you know, a manager who's thinking about their own health, and thinking, oh, that might, you know, I might need to do something. Where can they find you? How would they get in touch with Raparu?
Well, we have a website, the www.raparu.co.uk.
Yeah.
And we have an email address, which is info.raparu@gmail.com.
So info.raparu@gmail.com.
And that's our generic email address that people can contact us. And Paul, who I'm working with, obviously, looks frequently at it.
Yeah, and also you're on social media, Raparu, you're on Twitter and Facebook, mainly. And the website there, again, is raparu.co.uk. It's RAPARU.
Correct.
Yeah. Ruth, thank you so much for joining me here in the studio. That's Dr. Ruth Chambers OBE, who's one of the co-founders of Raparu Consult CIC, here on Business Spotlight, which is in partnership with Cross Rhythm City Radio and Baba Baboon.
Business Spotlight, shining a light on our local business community. Brought to you by Cross Rhythms and Baba Baboon.